Have you ever wondered if the pills you take every day could quietly be destroying your brain health? Not after years, but within just 3 months of daily use. Some common medications could start shrinking your brain without you even realizing it. Every day, millions of seniors take medications for allergies, anxiety, sleep, and blood pressure, trusting these drugs because their doctors prescribed them. But a wave of new research is revealing a scary truth. Some of these drugs might be silently triggering memory loss, confusion, and even dementia long before or any noticeable symptoms appear. A recent study found that several popular medications, many prescribed to seniors, could increase the risk of dementia by up to 80%. These pills, which are considered safe by many doctors and handed out daily, could cause serious damage to the brain. Are you or someone you love taking any of these medications? And do you really know the potential effects they could have before it's too late? Let's find out now. So, if it's not age, but the medications you're taking, could you even recognize the changes in your brain? The troubling thing is, many of the medications seniors trust and take daily can cause serious damage to brain function without them even knowing. Recent studies show that some of the most common medications, thought to be safe, actually increase the risk of memory loss and cognitive issues by up to 80%. Some of these drugs could even shrink the brain, impair memory, and make you lose basic cognitive functions without any obvious warning signs. What's concerning is that these medications are often prescribed by doctors and are still considered safe by many people. But the latest research shows they can reduce brain activity, causing users to feel foggy, distracted, and even develop dementia symptoms before any clear signs emerge. These medications may not always cause harm immediately, but when used long-term, their effects can gradually weaken your memory and cognitive abilities. That's why understanding the medications you're taking and asking your doctor about their side effects is crucial. As we age, our bodies and brains naturally change. However, there's another factor many seniors don't realize: the impact of the medications they take daily. These drugs, while prescribed and often deemed safe, can have a silent, damaging effect on our mental sharpness and cognition. The way they affect the brain might not be immediately obvious, but their long-term impacts can be severe. One of the most dangerous categories of drugs that seniors frequently use is opioids, painkillers. Drugs like oxycodone, hydrocodone, morphine, and fentanyl, prescribed for chronic pain, can negatively affect brain function. Studies show that long-term opioid use can increase the risk of cognitive decline by up to 40%. This is alarming, as these medications not only numb pain, but also suppress brain function, impacting areas related to memory and emotions. They affect the white matter in the brain, which connects different regions, leading to slower thinking, hazy memory, and emotional flatness. Seniors using opioids long-term may experience a quiet decline in cognition, which often goes unnoticed until it becomes serious. A typical case is Sheila, a 72-year-old woman who was prescribed oxycodone after knee surgery. Initially, it was just for pain relief, but Sheila gradually became foggy and disoriented. She once asked why her bed was floating and couldn't remember how to unlock her front door. Sheila's husband noticed. She became quieter, slower, and frequently zoned out mid-sentence. 3 years later, Sheila was diagnosed with early-onset dementia. This clearly shows how painkillers like opioids can cause significant damage to brain health, increasing the risk of dementia without us even realizing it. In addition to opioids, another category of drugs linked to cognitive decline is benzodiazepines anti-anxiety medications, such as Xanax, Valium, and Ativan. These medications, often prescribed for anxiety and sleep problems, can have serious side effects, especially with long-term use. Benzodiazepines work by suppressing brain activity, slowing down nerve cell activity to reduce anxiety and promote sleep. However, long-term use can lead to cognitive decline and brain shrinkage. Research shows that using benzodiazepines increases the risk of dementia by up to 80%. These drugs don't just affect memory, but also reduce learning ability, causing disorientation and even mental health issues. Walter, 69, is another example. After his wife passed away, Walter was prescribed lorazepam to help with sleep. Initially, it helped, but within a few months, his family noticed odd behaviors. He started doing things like rummaging through the trash or leaving his car running overnight. After a while, Walter was diagnosed with moderate stage dementia, and doctors believe the lorazepam contributed to his condition. The troubling part is that benzodiazepines are still commonly prescribed to seniors without adequate warnings about the long-term brain damage they may cause. Another group of drugs seniors should be cautious about is muscle relaxants. Drugs like Flexeril and Soma, commonly prescribed for chronic pain or after surgery, can also affect memory and cognition when used long-term. Research has shown that muscle relaxants can increase the risk of dementia by 36% because they slow down the central nervous system and reduce mental alertness. For seniors, the sedative effect of these drugs can be even more intense, gradually dulling memory, awareness, and decision-making. These medications are often seen as harmless for occasional pain, but when taken regularly, they can quiet the very brain circuits needed to stay sharp. Yvonne, a 73-year-old woman, was prescribed cyclobenzaprine for chronic neck pain. After starting the medication, her family noticed odd behaviors, like pouring milk into shoes or confusing the kitchen for the bathroom. Eventually, Yvonne was diagnosed with early-stage vascular dementia. This case shows that long-term use of muscle relaxants can increase the risk of cognitive decline, if not carefully monitored. Beyond these categories, other drugs like first-generation antihistamines, sleep medications, statins, and proton pump inhibitors (PPIs) can also damage the brain if used long-term. Studies show that using first-generation antihistamines like Benadryl can increase dementia risk by up to 54% because they block acetylcholine, a brain chemical essential for memory and learning. Sleep medications like Zolpidem and Lunesta are linked to cognitive impairment, while statins cholesterol-lowering drugs can reduce memory, especially in high doses. Franklin, a 71-year-old man, is an example of using antihistamines. After using these every night for sleep, he began experiencing memory issues, asking the same questions repeatedly. Eventually, he got lost while driving to his church. He was later diagnosed with Alzheimer's. This is the consequence of using medications without understanding the long-term risks to brain health. So, how can we protect ourselves from these dangers? First, it's crucial to become aware of the medications we're using. Always ask your doctor about the long-term side effects of the drugs you're taking, especially for seniors. While some medications might improve quality of life in the short term, if used long-term without proper monitoring, they can have serious consequences on mental health and brain function. The key is to discuss with your doctor alternative treatment options and find ways to minimize the hidden dangers of medications. As we've seen, using medications for extended periods can have serious consequences for brain health, especially as we age. However, understanding and being aware of the effects of these drugs not only helps protect your cognitive abilities, but also helps us make informed decisions about our healthcare. One important aspect that many seniors don't realize is that medications don't just affect brain function, they can also alter how the body operates, affecting our decision-making abilities and actions. This is especially important for the types of medications seniors commonly use, such as first-generation antihistamines, sedatives, muscle relaxants, and opioid painkillers. Research has shown that using antihistamines, like Benadryl or Unisom, can increase dementia risk by up to 54% because they interfere with acetylcholine, a critical brain chemical needed for memory and learning. Similarly, sedatives like Xanax and Valium can reduce alertness and cause brain shrinkage when used long-term. If not careful, these drugs can slow down the brain, making it harder to make decisions and maintain independence. So, what's the solution? The answer lies in awareness and changing our medication habits. If you or a loved one is taking these medications, talk to your doctor about safer alternatives and focus on maintaining a healthy diet and exercise routine to protect brain health.